I could think of two patients where one where plasma cell-free DNA was more informative, and then the other where tissue biopsy was more informative. So I had a patient who was in her mid-40s, and she had an EGFR exon 19 deletion. So I discussed with her afatinib versus erlotinib, and we had decided to try afatinib. And she was on that for about 11 months, and then she had some small pulmonary nodules that looked new, but it was non-specific, and so we decided she was asymptomatic, and we decided we'd wait a few weeks and get another scan, and the following scan showed clear progression, including growth of her primary lesion in the lung, and she was developing a little more cough. And we decided at that time, she was in clinic, that we would send cell-free DNA from the blood, and we sent that, and it was negative for both the activating mutation and EGFR T790M, both exon 19 deletion as well. So that activating mutation and T790M were both negative, and we decided to get a tissue biopsy right away of the primary lesion. We had sent that off, and the tissue was positive for EGFR T790M. She was placed on osimertinib and had an excellent response and is doing very well. With minimal side effects. I had another patient who was in her late 60s who developed growth of her primary lung cancer and some other pulmonary nodules, and it was clear progression. She was having some more symptoms. I started by obtaining a tissue biopsy. This was right before cell-free DNA testing was available at our institution, and she had a biopsy, but the location turned out to be very difficult, and there was insufficient tissue for molecular testing. And at that point, we had cell-free DNA testing available, and so we sent that off, and that was positive for EGFR T790M. So tissue negative, plasma positive this time, and in that patient, I think it was like a week before I saw her for follow-up, osimertinib was approved by the FDA. So it was perfect timing, and we put her on osimertinib, and she had a fantastic response for some time. So that worked out well, and that's the other side. So depending on the situation, plasma cell-free DNA testing can be informative, or tissue testing. But I think the key is to try to test and find T790M positivity any way you can in order to get osimertinib for the patient. So I generally start off with plasma because the patient's there in clinic, and then if it's positive, switch to osimertinib if there's symptomatic progression, there's high tumor bulk, there's clear growth of the cancer, and the tempo is picking up, or if the plasma's negative, go to tissue to try to detect T790M that way.